We are on your side now with our health news, and March is Colon Cancer Awareness Month. Of cancers that affect both men and women, colon cancer is the second leading cause of cancer-related deaths in the United States. It's important to be screened for the disease, and CBS 47's medical expert Dr. Dave joins us to tell you what you need to know to stay healthy. So thanks for joining us this afternoon.
Good afternoon, Jenny.
Okay, colon cancer is one of those where people hear it, they kind of get a little freaked out about it. So what do you have to tell us?
It is the second leading cancer killer, and over half the deaths can be prevented from screening, but 1 in 3 Americans are not getting screened as recommended.
Okay, so we could cut down the deaths by half if people just go get screened, but they get a little nervous about that.
People are concerned about the preparation because of laxatives. They may not have health insurance coverage, or they may not discuss it with their doctor. So there are 5 things that folks can be aware of about screening. The first is who should get screened. The risk of colorectal cancer increases with age. Most people should start getting screened beginning at age 50. If you have a high risk, you want to get screened earlier. The screening tests are looking for a precancerous polyp, which can develop into a cancer. This cancer can be removed, or a early stage cancer which can be treated curatively. So there are 3 screening tests to be aware of.
So get it done. If they find a polyp, they can take it out and you'll be okay, right?
That's right. So number 2, the fecal occult blood test, the first screening test, which is a stool blood test looking for blood in the stool that cannot be seen from a bleeding polyp or cancer. This test is done once a year. Number 3, the second test is a colonoscopy. This is a test that allows your doctor to look directly at the lining of the colon from the top to the bottom, looking for any polyps or abnormal growths. If these are seen, they can be removed right then and there. And if you don't have anything abnormal, you don't have to have the test for another 10 years.
Oh, 10 years. Okay,
every
that's
10
not
years.
Bad. We can do that.
And then number 4, the third test is a flexible sigmoidoscopy, also a scope test that allows your doctor to look at the colon, but it's only looking at the lower half of the colon, the sigmoid and the rectum, and this is done every 5 years. So talk to your doctor about these 3 screening tests and which is right for you, and get the screening test before you develop symptoms. Number 5 is coverage for these tests. Most insurance companies do cover these tests, but if you do not have coverage, you can call the California Department of Public Health at 916-449-5300 to find out what resources are available for you.
All right, so you're a doctor. Reassure us. These doctors, they do colonoscopies all day long. You don't have to be weird about it, right?
They're safe, and actually for the scope test, you can be sedated, you can be asleep, so you won't even feel anything in most cases.
Love that. You don't even have to remember it, right?
Absolutely.
All right, thank you so much to
You're welcome.
Dr. Dave. If you have a question or topic or an idea for her, you can send it to our news desk at cbs47.tv. We'll look at your emails, and Dr. Dave joins us every Tuesday during our news show.